Welcome back. It's still Morning Rush on Metro Television. We are live on the DSTV channel 277, live on Facebook and YouTube is Metro TV. And don't forget to follow us on Instagram, Metro TV _GH. This morning we are looking at ovarian cysts. I mean, most women at some point in time have ovarian cysts, and mostly is harmless. But then if you don't take critical look at it, or if you don't pay attention to it, you can suffer serious complications. And this morning we have Dr. SHERIF Okyeere, a health practitioner from OVARIAN Scientific Herbal and Alternative Medical Hospital, to tell us more about this ovarian cyst. Good morning, Doc.
Good morning.
How are you?
I'm doing well. Yes.
Good to have you here.
Good morning.
Do you like your talk songs?
Yeah.
That's what.
No, you don't understand.
That's what you mean. You mean. Look, like I said, at some point in time,
Yes.
Most women will suffer ovarian cysts. Is that statement true?
Yes.
Okay.
Of course, it's true. It's true because it is one very common, especially with reproductive women.
Okay.
So women at their reproductive ages has a tendency one way or the other to develop ovarian cyst through their lifetime.
Okay.
You understand? So that statement, is true.
So it means the moment a woman, a lady, let me say, I don't want to say a kid, a female adolescent, that is what I wanted to say,
Yes.
starts to menstruate, there's a chance of experiencing ovarian cyst.
Yes.
Okay.
So yes, so from even at some point there are cases, although they are rare, but there are cases where you see neonates having issues of a cyst in their ovaries of that sort. But it is not that common. It is always common during from adolescence or from puberty to the time they get to menopause. So it is very common within this age group. Yes.
Yeah, that's why they say women, our problem is with men. We start with menstruation and we end with menopause. Anyway, what exactly is ovarian cyst? Like, let's define it. Let's understand what exactly it is.
So ovarian cyst is actually a sac that is filled with fluid.
Okay.
And which arises from the ovaries. So you see in an ultrasound, you see a sac that is filled with fluid, and depending on the situation, you see a couple of them on the ovaries. It arises from the ovaries. So that is literally what ovarian cyst means: a sac that is filled with fluid or semi-liquid, substances. You understand? Because there are some situations where you have some cysts that have substance more than just fluid or liquid. So in some situations you can see a semi-liquid substances, and in some of the cysts you can even find hair, teeth and other stuff in it. So it is basically a sac that is filled with fluid that arises from the ovaries of women.
What is supposed to be the ideal one?
Okay, so women, we have ovaries, you understand, and ideally every month every woman is expected to ovulate an egg.
Yeah.
You understand? Yes. So these eggs go through processes, you understand. So usually when you take like a 28 cycle of a woman, within the mid portion they have what we call follicles. So the follicles is what grows up to the ovaries that they ovulate at every point in time. So during that mid-cycle, we have what we call follicle stimulating hormones, which will help the follicles, to mature. You understand? So at some point, when there's a release of follicle stimulating hormones, it will cause a surge in luteinizing hormone. Now, this luteinizing hormone is supposed to help the egg to come out from their shell, because they are not open, they are encapsulated. You understand? So when the follicle stimulating hormones are released, it will cause a surge in what we call luteinizing hormone, which will help eggs to actually come out. So that is what goes on in in women
Yeah.
every month, and there are other hormones, progesterone, estrogen, that also plays some role in these processes.
Yeah.
You understand? So if there's a problem with either the follicle stimulating hormone or the luteinizing hormones within the ovaries, it can contribute to fluid accumulations within these, within the or around the ovaries, which will cause this ovarian cyst that we are talking about.
That's
Okay, so on the screen, as we had it, the sac you were referring to,
Yes.
I beg your pardon, is what is being shown there as your ovarian cyst.
Yes. So you see, for a normal ovary, you don't see any sac around it with some fluid, but for the ovarian cyst, you see there has been some growth, so to say, something that has swelled up around the ovary, and within it, it's just fluid. So that is what happens with ovarian cysts. There's a fluid accumulation that will cause a swell up or a accumulation of fluid within a specific sac, which will cause problems around the ovaries. So that is typically how ovarian cyst looks like in an ultrasound. There are cases that you can see multiple of them.
okay.
You understand? In an ultrasound, you could see a multiple of these cysts that we are seeing now on one ovary. So it can happen that way as well. Yes.
In the video I was watching on YouTube, a doctor was saying that sometimes it sort of moves.
Yes. So yes. The cyst can cause movement, within these ovaries, and when it happens that way, it has a tendency of causing what we call ovarian torsion or ovarian rupture, and it's a complication for ovarian cyst, because when it happens that way, usually it is even common with at the right side of the ovary. So ovarian torsion and ovarian rupture, is common at the right side of the ovary, because every woman has two ovaries, one at the left side and one at the right side, and it is as a result of the colon, the sigmoid colon at the right side. So when there's this movement, it restricts, because the colon is there, it restricts the movement of these ovaries, which could cause the ovary to coil up and cause a torsion. And then when the torsion happens, it can cut blood supply to the ovaries, and it could cause torsion. And it could also happen that it could cause rupture of these sacs around the ovaries, and it's a complication, when it comes to that, because it comes with severe pains, fever, feverishness, and a lot of complications. At some point, some bleeding and all those stuff.
So in severe cases, would you say that it has to be removed?
Yes.
Or it finds a way to just...
yes and no, because just as I mentioned, that every woman can have cysts. We have what we call functional cysts. You understand? And usually functional cyst doesn't need any treatment. It goes by itself. You understand? But there are other types, dermoid cyst, cystadenoma, and other types of cysts that could cause complications. And in severe cases, it can get bigger. You understand? Up to about 24 centimeters in diameter. So it can get, so some cysts can really grow to be very large. And when it happens that way, the only solution is surgically, we take the cyst out, so that you'll be free. Because if it becomes that big, there's a lot of discomforts and
heaviness, bloating. I'm thinking that is it.
You get it. So these are some of the signs that you're supposed, some pain, and you don't feel comfortable. You understand? So surgically, that should be done when it gets to that level. And then also, these tumors, these cysts, usually are benign. You understand? But there are some that has a chances of malignancy. Malignancy in the sense that it can be what we call cancerous. Some of these things can lead to, malignancy. You see, it will start as a normal cyst, as a functional cyst. At some point, it will be getting bigger, and at some point, it can cause some of these complications. So, yes, for functional cysts, you don't usually need any treatment. But then, If it becomes bigger, if it moves from the fact that it's not functional, dermoid and no cystadenoma and all those things, surgical or surgery is an option. But then there are some that, you know, medications can also, you know, help resolve, you know, some of these situations, because there are situations where cysts develop as a result of hormonal imbalances, or there are some women, because of, you know, some treatment that they are going through, especially with hormonal therapy, they develop some of these cysts more. So in such cases, when it's starting, you identify where it's coming from, you can give medications to help, you know, that situation. There are some cysts that can also develop as we call it endometrioma, as a result of endometriosis, when the lining of the uterus grows outside the uterus, and it can, you know, get to the ovaries to cause, you know, some of these. And in that situation, it's very severe pain, a lot of discomforts that comes as a result of that. So, you know, when you're having this issue, the first thing is we have to identify what sort of cyst that you're experiencing in the first place. What are the chances, you understand, of it getting to malignancy? What are the complications that can come as a result of that? So that we can actually know what sort of treatment to give, whether to go for surgery, whether to give medication, whether to do a watchful waiting, whether to even leave it for it to go off by itself, you know, in the case of functional cysts and the likes.
So the symptoms that you have talked about are the
bloating.
Yes, bloating, dull pain,
abdominal pains,
heaviness, you know, abdominal pains and all those things. But some can also go asymptomatic. Yes, so there are women who have cysts and they are not showing any signs.
That's even dangerous.
And it happens to a lot of women. Usually you see women coming to hospital with cysts when probably maybe their cycle is not regular, or probably they are married, they are not able to conceive, and it dawns on them. If not, if they are not showing any sign, they are fine, and they don't usually go to hospital. So that is why it is also very important that reproductive women at least should get themselves checked. You know, one of the diagnostic measures is to do an ultrasound scan. Ultrasound scan is a non-invasive, you know, scan that you can do at any point in time to actually check the ovaries to see whether they are in good shape, whether there's cysts, or to just find out what is happening, you know, within.
How was that one conducted?
Ultrasound scan. So there's.
The one you put the fluid in your stomach and the machine.
Yes,
that one I've seen.
You image it to see what is actually going. So it gives you a clear view of how the ovaries are and whether there's any problem whatsoever around it.
That one doesn't require you seeing a gynae. The one you open your legs wide, have to take the machine. It doesn't require that.
You know, with ultrasound, we have transabdominal that can be done here, and we have the endovaginal that, you know, that has to go inside to actually, you know, evaluate it and see. So either way you can actually do to see that.
So we've been having a conversation on ovarian cysts. I'm learning. I am learning. I'm learning a few things. So at the end of the day, if you, as Doc says, sometimes it's asymptomatic, and so you wouldn't feel any pain. But he's saying that you need to check yourself at the hospital, you know, every now and then, so that they can detect some of these things, and that is why you should be going to Amen Scientific, right? Yes,
of course. If you're having any issue with regards to ovarian cysts and ovarian disorders, I entreat you to come to Amen Scientific Herbal and Alternative Medical Hospital. If you are not having any of these things and you want to get yourself checked within the ovaries and all those things, you can also come to Amen Scientific Herbal and Alternative Medical Hospital. We can do these scans and other blood works as well. There are some tests that can also be done. Just come to Amen Scientific Herbal and Alternative Medical Hospital, and we can get it checked for you.
All right. So the numbers are on your screen. You do want to call the numbers, right? And you can also go to the offices.
Yes.
Klagon.
Yes, Klagon, close to the Ashamai Underbridge, and Dome. Senate Flats, close to the rail line, Kumasi, KGTM room, opposite the zoo, Also in Kumasi at Achumate Chimain, Takrady, Apramdo, Sunyani, Kotokrom. In fact, we have 18 branches across the country. So call the numbers on the screen and we'll direct you to the nearest Amen Scientific Herbal and Alternative Medical Hospital.
All right.
Thank you very much, Doc. Thank you very much.
Welcome.
Coming in as always. Yeah.
Okay, so we are going for a quick commercial break. When we return, source is next.